Hey guys, Dr. Mike here. Have you ever woken up feeling like your head is stuffed with cotton, your throat scratchy, and you can't stop sneezing? You're not alone. Upper respiratory infections, or URIs, are incredibly common. In fact, they're some of the most frequent reasons people miss work or school. URIs are like that friend who always seems to show up uninvited, bringing along a symphony of sniffles, coughs, and maybe even a fever. They can really throw a wrench in your day, making it hard to focus on anything else. But here's the good news. Understanding the different types of URIs can arm you with the knowledge to fight back. In this video, we'll break down the most common culprits, explore their symptoms, and discuss how to find relief and stay healthy. So let's dive in and clear the air about URIs. Let's start with a classic, the common cold. This viral infection is caused by a family of viruses called rhinoviruses, and trust me, they're everywhere. They spread like wildfire through the air when someone coughs or sneezes, and even touching contaminated surfaces can leave you vulnerable. The good news is most colds are relatively harmless and tend to clear up on their own within a week or so. You'll likely experience the usual suspects: sneezing, a runny nose, a sore throat, and maybe a mild fever. Rest, fluids, and over-the-counter remedies can be your best allies in weathering the storm of a common cold. Next up, we have sinusitis. This one's all about those pesky sinuses, the air-filled cavities in your skull. When they become inflamed, often due to a viral, bacterial, or even fungal infection, you're in for a world of discomfort. Imagine feeling pressure and pain in your face, especially around your forehead, cheeks, and even your teeth. Add to that a stuffy nose, thick mucus, and headaches that just won't quit. Sinusitis can be acute, lasting a week or two, or chronic, lingering for weeks or even months. Treatment often involves saline rinses, decongestants, and sometimes antibiotics in case of a bacterial infection. Now let's talk about pharyngitis, which is a fancy way of saying sore throat. This inflammation of the pharynx, the back of your throat, can make swallowing a real pain, literally. Viruses are the usual suspects here, but bacteria like the one responsible for strep throat can also play a role. Along with the telltale throat pain, you might experience difficulty swallowing, fever, swollen lymph nodes in your neck, and even white patches on your tonsils. While most viral pharyngitis cases resolve on their own, bacterial infections often require antibiotics to clear things up. Moving down the respiratory tract, we encounter bronchitis, an inflammation of the bronchial tubes that carry air to and from your lungs. This one's notorious for triggering a persistent cough, often accompanied by mucus production and chest discomfort. In most cases, bronchitis is caused by a virus, and it usually resolves within a couple of weeks. However, if you're dealing with chronic bronchitis lasting for months or recurring frequently, it could be a sign of an underlying condition like COPD or chronic obstructive pulmonary disease. Treatment for bronchitis typically involves rest, fluids, and medications to manage cough and mucus. Ever had those lumps of tissue at the back of your throat become red, swollen, and painful? That's tonsillitis, an infection of the tonsils. Viruses are often the culprits, but bacteria can also cause this uncomfortable condition. Along with throat pain, you might experience difficulty swallowing, fever, swollen lymph nodes in your neck, and even bad breath. While most cases of tonsillitis resolve with home care, severe or recurring infections might require surgical removal of the tonsils, a procedure known as a tonsillectomy. If you've ever lost your voice or sounded like a hoarse whisper, you've probably encountered laryngitis. This inflammation of the larynx, your voice box, can temporarily steal your ability to speak clearly. Viruses are the most common cause of laryngitis, and it often accompanies other URI symptoms like a cold or the flu. Resting your voice, staying hydrated, and using a humidifier can help soothe the inflammation and bring back your vocal cords A-game. Now let's shift gears to a more serious condition, epiglottitis. This bacterial infection affects the epiglottis, the flap of tissue that covers your windpipe when you swallow, and it can be life-threatening. Epiglottitis often comes on suddenly, causing severe throat swelling, difficulty breathing, drooling, and a high fever. If you or someone you're with experiences these symptoms, seek immediate medical attention. Epiglottitis is a medical emergency that requires prompt treatment with antibiotics and airway management. Parents, you've likely encountered this one croup. This viral infection is common in young children and infamous for its signature barking cough, which often sounds like a seal's bark. Croup is caused by inflammation of the larynx and trachea, leading to airway narrowing and difficulty breathing. The barking cough is often worse at night and can be quite frightening for both children and parents. Treatment typically involves keeping the child calm, using a humidifier, and in some cases steroids to reduce inflammation. Let's be clear, influenza, or the flu, is not your average cold. This contagious respiratory illness is caused by the influenza virus and packs a powerful punch. Unlike a cold, the flu often hits you suddenly with high fever, chills, body aches, fatigue, and respiratory symptoms like coughing and congestion. It can be quite debilitating and even lead to serious complications, especially in young children, older adults, and those with weakened immune systems. Vaccination is the best defense against the flu, and antiviral medications can help shorten the illness's duration if taken early on. Whooping cough, also known as pertussis, is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. It's characterized by severe coughing fits that can make it difficult to breathe, often followed by a whooping sound as the person gasps for air. Whooping cough can be particularly dangerous for infants and young children who are at higher risk of complications like pneumonia, seizures, and even brain damage. Vaccination is crucial in preventing whooping cough, and antibiotics are used to treat the infection and reduce its spread. Beyond the common culprits we've discussed, several other infections can target your upper respiratory tract. Adenoiditis, for instance, involves inflammation of the adenoids, those infection-fighting tissues located near your tonsils. Tracheitis affects the trachea, causing inflammation and a harsh cough. Then we have scarlet fever, a bacterial infection that causes a distinctive red rash along with other URI symptoms. Diphtheria, another bacterial infection, can lead to a thick coating in the back of the throat, making breathing difficult. And finally, RSV, or respiratory syncytial virus, is a common cause of respiratory infections in young children, sometimes leading to bronchiolitis, an inflammation of the small airways in the lungs. So there you have it, a crash course in understanding upper respiratory infections, from the common cold to more serious conditions like epiglottitis and whooping cough. These infections can really throw a wrench in your plans. But remember, knowledge is power. Prevention is key when it comes to URIs. Practice good hygiene by washing your hands frequently, covering your coughs and sneezes, and avoiding close contact with sick individuals. Vaccination is also crucial in preventing influenza, whooping cough, and other serious infections. By understanding the different types of URIs, recognizing their symptoms, and taking preventive measures, you can stay one step ahead of these common illnesses and enjoy a healthier year-round. And as always, if you have any concerns or experience severe symptoms, don't hesitate to reach out to your healthcare provider. Stay healthy, everyone.